joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are here today to provide everyone an update on where we are with respect to COVID-19 for the state of Maine for today, Friday, November 13th, 2020. I'll start by walking through where things stand with respect to the pandemic and the epidemiology, and then turn things over to Commissioner Lambrew. I begin today's update on a very sad set of notes. The Maine CDC has received reports of 3 additional individuals who have passed away with COVID-19. One was a man in his 70s from Penobscot County. Another was also a man in his 70s from Androscoggin County. And the third was a woman in her 80s, also from Androscoggin County. Their deaths mark the 160th, 161st, and 162nd deaths associated with COVID-19 in the state of Maine. I'd like us all to take just a moment to mourn the passing of these 3 members of our community. And also bear in mind and also remember the passing of not just their deaths, but also in total now, the 15 people in Maine who have died just this month alone with COVID-19. We'd like to take a second to offer their friends, their families, and their entire communities our deepest condolences during this time of grief. May the memories of their lives be with them always. Right now, across the state, there are a total of 8,639 individuals who have been confirmed to have COVID-19. Of those, 7,748 are laboratory confirmed cases and 891 are probable cases. Collectively, this reflects an increase of 243 additional cases today. Of those, the increase is largely been driven by the increase in laboratory confirmed cases, of which 232 of the 243 are laboratory confirmed. Only 11 cases of today's increase are among probables. Cumulatively, 566 individuals have been hospitalized. And just in the past 30 days alone, 94 people in Maine have been hospitalized with COVID-19. Right now, 66 people are in the hospital, 4 more people than just yesterday. Of those 66, 18 are in the intensive care unit. That's 2 more people in the intensive care unit than yesterday, and 6 people remain on ventilators. Overall, across the state right now, there are 92 ICU beds that remain available. As I mentioned a moment ago, there have been 162 deaths among individuals with COVID-19, and 6,428 individuals have recovered. Among our cases right now are 1,340 healthcare workers. Taking a look at yesterday's cases alone, 28% were from Androscoggin County, and 15% of yesterday's cases were from Cumberland County. I'd like to take a second now to talk about some of the outbreaks in which Maine CDC is most actively engaged. Let's first start by noting 5 additional outbreak investigations that Maine CDC has opened just in the past day. One of them is at the Faith Bible College International in Charleston, where we are aware of 3 cases. We've also opened an outbreak investigation into 15 cases of COVID-19 associated with Husson University. Also, we've opened an epidemiological investigation into Lawrence Junior High in Fairfield, in Kennebec County, where we've detected 3 cases. Also, in another school at Portland High School, where we've detected also 3 cases. And finally, an outbreak into the Skowhegan-Madison Elks Lodge, where we've detected 5 cases. Now, I'd like to make 2 observations about some of these outbreaks. The first is that this number of new outbreaks on a day-to-day basis seems concerning, and the truth is, it is. But it's equally important to keep in mind that one of the reasons we are able to detect and piece together what's happening with these outbreaks is because we have continued with our case investigations and contact tracing. When we learn of cases, it's rare that people come diagnosed to Maine CDC and say, oh, by the way, I was part of this outbreak. Instead, our disease detectives, our gumshoe epidemiologists, have to compare their notes on a day-on basis to determine and look for patterns where we see people who have been in the same place. That triggers what we then use as the threshold to open an investigation to determine whether more might be going on. So, of course, this number of new outbreaks is concerning, but it's also important to bear in mind that we have insight into what's going on because of the continued great work by the Maine CDC epidemiologists and contact tracers. The other observation that I'd like to make with respect to these outbreaks is what we've been seeing as it relates to the interplay between outbreaks and social gatherings. What we've started to see is a bit of a circular problem, where social gatherings are leading to more community spread. And that community spread is making those social gatherings even more risky, in itself leading to more community spread. What we're starting to see is an unvirtuous cycle that's building upon itself, making each social gathering even riskier and generating cases of individuals who then go back out into the community and spread COVID-19 in their communities. This is a very difficult cycle to intervene upon, and it's all the more reason we want everyone to know both where we are and what they can do to help us break this cycle, namely wearing face coverings. I'd like to take a second now to talk about at least two pending outbreaks in which Maine CDC has been actively engaged. The first is to provide an update on the outbreak at the Russell Park facility in Lewiston. As of right now, there are a total of 129 cases of COVID-19 associated with that facility, 64 of those cases among residents and 65 among staff. Sadly, there have been 3 deaths associated with that facility, and right now, 3 residents are in the hospital. Maine CDC is continuing to work with the leadership and administration of Russell Park to make sure that all the resource requests that they have, whether that's around best practices on infection control, PPE, assistance with laboratory testing, and assistance with staffing, all of those resource requests are being met, and we will continue to do so. Next, I'd like to turn to provide some updates on where we are with testing. As of right now, the 7-day positivity rate for PCR tests received in Maine stands at 2.53%. And our testing volume stands at 613 tests for every 100,000 people in Maine. Very quickly, before I turn things over to Commissioner Lambrew, given where we are about halfway through the month, I wanted to take a moment to just take stock of where we've been just in November alone. Just since November 1, which is about 1 incubation period, we've had 1,924 cases just this month alone. Our positivity rate in Maine for tests has jumped from 0.9%, which is where we began the month, to 2.5%, which is where we are right now. On November 1st of this month, there were 28 people in the hospital, 7 of whom were in the ICU. Today, 66 people are in the hospital, 18 of whom are in the ICU. As we've discussed, the fear that we have expressed of what we saw on the horizon with COVID-19 coming is very squarely here. And the concerns that we've expressed around the possibility of exponential growth have unfortunately been realized. The surge that we have predicted has arrived, and it has arrived with force and ferocity. Now is the time for all of us to make sure that we're taking necessary steps to keep a lid on things. So with that, I'd like to turn things over to Commissioner Lambrew.
Thank you, Dr. Shah. Today, the Mills administration announced that effective Monday, November 16th, Massachusetts is no longer exempt from Maine's quarantine or negative test requirement. People coming here from Massachusetts must either quarantine for 14 days or receive a negative COVID-19 test with a sample taken no longer than 72 hours prior to arrival in Maine. The same protocol applies to Maine residents returning from Massachusetts or any state other than New Hampshire and Vermont. This decision comes after the administration reviewed recent public health data in Massachusetts and other states. These data include, but are not limited to, positivity rates and new case rates. In the past 2 weeks, Massachusetts has had a positivity rate of 2.5% and 3,384 new cases per million. By comparison, Maine, which is also seeing an increase, recorded a positivity rate of 1.8% and 1,350 new cases per million. Like most people in Maine, Governor Mills is extremely concerned about the spread of the virus as we head into the holiday season, when we customarily gather with friends and families, often from different places. This policy is designed to keep people, including our loved ones, safe and healthy. We urge travelers to know before you go. Under the department's standing order, any person in Maine who feels they need a test with or without symptoms can get one at a participating site at no charge without an order from your provider. These sites include 27 swab and send locations that offer testing to the public under an agreement with the department. It remains critical that Maine people take steps to protect themselves, their businesses, and others by wearing face coverings indoors and out, keeping 6 feet apart, avoiding large gatherings, and washing hands often with soap and water. With that, I'll turn it back over to Dr. Shah for questions.
Great. Thank you, Commissioner. And we will kick off our questions this afternoon from our colleagues in the media by turning first to Patrick Whittle at the AP.
Thank you so much. I appreciate it. The question is for both or either of you, and it's actually two questions. So first of all, I would love to know both of your thoughts about the report from the US CDC regarding the Millinocket area wedding and reception, which was the cause of more than 170 cases of the virus. I'm assuming you've seen it by now and have been in touch with them and have some thoughts on their findings, which seem largely in line with your own. And also, I would love to know if we're any closer to a possible return of stay-at-home orders or other restrictions.
So I'll take that first one, Patrick. One important clarification, that report was published by the US CDC, but it was the result of scientific analysis by the Maine CDC. If you take a look at the authors on that report, it was the team of epidemiologists at the Maine CDC who drafted that report for scientific publication. It was published in the US CDC's flagship journal called the MMWR. And we did that for a couple of reasons. The first was we wanted to make sure that the other epidemiologists around the globe who are contending with COVID-19 had the benefit of understanding what we had uncovered with that outbreak. The second was we wanted to draw attention to just how far and wide and quickly and silently the virus can spread. So we endorsed the findings in that publication because they were our findings. So I was really proud of the team for, in the midst of managing an outbreak and major outbreaks and a pandemic, to do what science requires, which is for us to share our education and our understanding so others can learn from it.
And as we continue to watch what's going on with the pandemic, we continue to review options to see what's working, what may need to be improved. As you know, last week, Governor Mills did change her executive orders, limiting indoor gatherings, trying to ensure that we know where people should be wearing face coverings, eliminating some of the complexity of face covering wearing. You know, the bottom line is, if you have to ask whether you should be wearing a mask, you should be wearing a mask. And we really are encouraging people to take that very basic step that even in the last week, we have new evidence that shows it doesn't only protect others, it can protect yourself. Today, we took another action, which is further refining our travel policy, knowing that it's difficult. A lot of people go back and forth to Massachusetts for healthcare, educational purposes. Many of us have friends and families in that state, but we really think that it is wise to either quarantine when you come back or get a test. We made testing available throughout the state. It should be relatively easy for you to get a test, but that's just yet another step that we've taken. We do continue to look at all different options that would potentially further stop the spread of the disease. We have no additional announcements to make at this time, but we do continue to look hard at what's going on in other states, in other areas, to see what could further protect people in Maine from COVID-19.
I'm going to turn things over to Amy Brown next.
Thank you, Dr. Shah and Commissioner Lambrew. Commissioner Lambrew, did I understand you yesterday to say that your department is working more with stores, the larger stores, on ways to deal with this possible anti-masker protest at the grocery stores this weekend, and also how to deal with people who refuse to wear masks, who exploit that medical loophole? And if so, if that is what you were saying, can you tell us some more about how that's going and any guidance that you're providing them?
Sure. I do want to start by giving thanks to the Maine Community College System, the Department of Economic and Community Development. Many of the different trade associations throughout the state have been partners since March in educating workers at these stores on protocols, including, best practices for wearing face coverings, best practices for approaching people to encourage them to do so, as well as how to space different things like grocery carts and the checkout lines for supermarkets to make sure that they're safe. So we have had fabulous partnerships, and we always learn and refine those as we go on. So I want to say thank you to those people who have been helping keep Maine safe. With respect to people's right to express their views, some people do have political beliefs or different types of beliefs about things like face coverings. We do respect their right to express that view and to peacefully protest in places like public parks with permits. That said, we are concerned about people expressing their opposition to wearing face coverings by putting store workers or customers at risk. As such, we have been in communication with these stores to see what, if any, support they could use. But I do want to take a moment to thank people who work at grocery stores, people at the checkout counters, the baggers, people keeping the carts clean. We appreciate that every day you go to work, leaving your home to ensure our parents and grandparents, our neighbors and families have food and supplies. We will continue to work alongside you to protect you as well as other Mainers.
Is the law enforcement community involved in these discussions to step in and possibly help them out? I noticed that one of the things that was said in the past couple of days about this was that store owners could call code enforcement or possibly the police. I know in one situation in Belfast recently, we heard from a listener that the police told them to call 911 or 211, the state's warm line. So is there more discussion with law enforcement about their possible role in dealing with this?
So our colleagues at the Department of Public Safety are in daily communication with local law enforcement about best practices. They do continue to give them the information, the tools on the policies. And my understanding is that the stores involved, because they are stores, these are not public parks, are also potentially in touch with their local law enforcement. So we do continue to have that kind of dialogue, but recognizing again, the best way for us to ensure that people are safe is to just continue to encourage voluntary compliance and to encourage people when they have concerns to express those concerns in ways that don't put other people in danger.
Okay, so no details about plans for this weekend beyond that?
I have no additional detail what was happening at each of these stores.
Thank you. And Dr. Shah, I think you said that you were going to give information on 2 pending outbreaks, and then you mentioned Russell Park and you didn't mention another. So I don't know if there was someone else there, another one that you were going to talk about, but do you have a sense of how many ongoing outbreaks you're dealing with now, kind of ballpark, and also if any of them involve possibly people coming into the state with the wreath making businesses down east, and also an update on kids piece?
Sure. We can get you the number of pending and open outbreaks. It's growing as the virus has spread and has seeded itself in the community. that level of community seeding is now generating more and more outbreaks. So that list is continuing to grow. We're not aware of any outbreaks associated with the migrant agricultural workers that you mentioned. And with respect to kids piece, as of right now, that outbreak remains at 17 individuals who have been affected.
Great. Thank you.
I'm going to turn things over to Patty White next.
Thanks, Dr. Shah. At the rate we're going with all of the key metrics, the cases and hospitalizations and the positivity rate, where do you see us in 2 weeks? I'm just wondering what kind of situation we're going to be on if we keep heading in on this trajectory. And do you see any indication in the metrics of any positive signs that more safety precautions are being embraced or that things could turn in a better direction?
So Patty, I'll start by noting and picking up where you left off, which is, could things turn in a positive direction? The answer there is absolutely yes. Other countries that had found themselves in difficult situations were able, with widespread mask wearing, for example, able to start bringing rates down. I'm thinking most notably and most recently of the experience in Japan as well as in Hong Kong. So there is a way out of where we are right now. And one of the things that the scientific community has uncovered and now has a better understanding of is the exquisite benefit of mask wearing. And relative to almost all the other interventions, mask wearing coupled with physical distancing is taken in tandem the best set of tools we've got. Now, where things go in the future, as you know, Patty, one of the most difficult things to predict in a pandemic is where things might go. And so I don't have a sense of where we will be in the next 2 weeks. If past is prologue, the likelihood of continuing on this path of exponential growth is something that probably will happen and we will continue onward on. And that is a definite risk. But the thing I think that I feel the most strongly about is that where we go from here is up to us. The virus is going to do what the virus does, which is spread opportunistically, but it need not be that way. We have within our wherewithal the tools right now to cut off the virus at every pass. So where things go is a mystery only insofar as what are we going to do about it? And are we collectively going to take the steps like face covering and physical distancing and avoiding indoor gatherings where the virus can transmit in small groups? Are we going to do those things? And that's the question in front of us. And that will determine what the next 2 weeks, let alone 2 months, look like.
Do you see any indications that that is happening at all? I mean, I know that the new mask mandate, that's new, but I mean, are you seeing anything that's sort of pointing to, okay, things may be shifting, or is it just too early to tell?
It really is too early, Patty. I'll just share some non-statistically significant observations, but share them all the same. A week ago, the positivity rate was climbing at a very steady clip, about 0.2 percentage points every day. That has slowed. That's encouraging, but that's not the end of the story. It could very easily pick back up. Our testing volume relative to other states, as well as relative to a model developed by the Harvard Global Health Institute at the public health school there, Maine's testing volume still continues to be leading the nation. That is to say, the model looks at what our positivity rate is, what our hospitalization rate is, and what the number of new cases are, and offers a prediction for how much testing we should be doing. And for weeks now, we have thankfully been well in excess of what the optimum testing volume is. That's one reason we're able to detect outbreaks, characterize them, and try to put a lid on them before they spiral. So we're doing a lot of the right things, but the virus is spreading even more ferociously. We've just got to now really double down on what each of us is doing on a personal level.
Okay, thanks.
Mm-hmm. I'm going to turn next over to Dustin at New England Cable News.
Thanks, Dr. Shah. I think you explained what prompted the Massachusetts update pretty clearly, so I don't want to ask about that again. Instead, I wanted to ask, have you thought about a best way to get a test if you are coming from Massachusetts to Maine, or are you thinking about coming up with a suggestion sheet for people coming from there who want to do things like ski this winter to get that test in a most efficient way?
Sure, I'll start, or maybe Commissioner. The bottom line, Dustin, is we've thought about that exact thing for individuals who are coming into Maine, be it by car or by plane. One reason we have offered now testing at a site in the jetport, not just for those who are getting off planes, but for anybody in the public who wishes to go. I heard from somebody yesterday who utilized the jetport site. So we are trying to angle our testing for incoming visitors to Maine, so as to make it as easy as possible to access that testing. Commissioner?
Yep, and we do work with the websites that show where testing is. There is one called gettestedcovid19.org that we work very closely with, so people can enter in their zip code, find out what is their local testing options, often find out do they need to get a doctor referral or not. So we do encourage people to look at that website to find out your testing options in your state. But as a reminder, these policies do apply to Maine residents who go to Massachusetts or Connecticut, Rhode Island, New York, New Jersey, or fly to visit their relatives. And again, those sites are both on that same site, gettestedcovid19.org, as well as Keep Maine Healthy. We've striven to make sure that people throughout the state of Maine do have access to timely and affordable testing. If you go to one of our state-sponsored sites, you don't have to pay for a test.
I'm going to turn now over to Evan Pop.
Hi, Dr. Shah. Thank you. So you mentioned previously this week that the CDC is concerned this latest spike in cases could exacerbate the racial disparities in Maine's virus cases. I was wondering if you could expand on that and say whether or not the CDC is seeing indications that the racial disparities are increasing, or when there might be enough data to say one way or the other in terms of this latest spike.
Yep, Evan, I think it's sort of similar to what Patty and I chatted about a moment ago, which is given where we are, we first of all remain deeply concerned that the racial disparities that we've experienced in Maine have persisted, and that's unacceptable. We've taken concrete steps to try to bridge that gap, and we can talk about those in just a moment. But right now where we are, it's too early to make pronouncements about whether the recent spike has more disproportionately impacted racial minorities or whether it has been in keeping. Too early to tell right now. I think we probably need a bit more data to really be able to get a better sense of the demographic impact statewide, not just with respect to racial minorities. But to zoom back out a second, as we've talked about for many months at these briefings, Commissioner and I have been deeply troubled by the gap in the impact of the gap of COVID-19 as it's affected racial minorities. We've both found it to be troubling and completely unacceptable. So we've started a regular cadence way back several months ago of meetings so that we were listening to those who are affected to furnish them what they need to help keep their communities safe, and also using that as an opportunity to make sure we're doing the things, for example, testing in areas where we know that there's a higher percentage of racial and ethnic minorities. So we can furnish them with testing, education, and then I think the key to much of it is the wraparound social services so that those who are affected by COVID can isolate safely and not risk infecting other members of their family, or be in quarantine safely so they don't necessarily get affected and pass it on to others.
Yeah, as we announced in the summer, Governor Mills authorized $1 million to be funded from the Coronavirus Relief Fund for community-based organizations, for those organizations run by, managed by the communities that they serve, with an extra focus on communities of color, given the racial and ethnic disparities that we've seen in Maine. So those organizations are themselves designing programs, implementing programs, giving us feedback on what we could be doing better. So that initiative is ongoing through the end of the year when the coronavirus relief funds end. We also worked on a regular series of engagement with healthcare providers, knowing that some of the challenge has been intrinsic to the healthcare system that often doesn't listen, often doesn't speak to these communities on an equal basis or a culturally competent basis. So We continue our work with our healthcare partners in the community to make sure that we are both supporting organizations to support their communities, but also making sure our system is being responsive as it needs to be during this pandemic.
Evan, I'll just wrap up by this, which is that work doesn't begin and it doesn't stop when we think about infections with COVID-19. It is also very much informing the planning that we are doing around vaccination as well. So we're keeping that principle and that concern front and center as we're approaching COVID-19 vaccination.
Great, thank you. And if I may just ask a question on another topic. If the current outbreak continues at this rate, are you concerned about seeing hospital bed shortages at some point? And specifically, I know you mentioned the number of ICU beds that are left. Is that an area of concern as well?
It's a concern. We have, throughout the pandemic, always kept a very close eye on vital healthcare resource availability. With the current increase in hospitalizations, we've made sure that we are keeping even closer tabs on it. That's a concern. We don't know if or with what speed it might happen, if it even happens at all. Well, we see that there is right now a significant amount of headroom in the hospitalization system to accommodate patients, especially and even those who are requiring intensive care units. There's also the availability of healthcare systems to convert their typical beds to intensive care unit beds as well. There are also, as I talked about yesterday, now is an FDA authorized medication that can potentially keep people out of the hospital. So although the numbers continue to climb, it's important to recognize the differences in today's pandemic as compared to the pandemic of earlier. But we remain concerned, and we are making sure we are equipped and planning for those possibilities if they become more pressing.
Thank you.
I'm going to turn over to Spencer Roberts at WAVI.
Thank you. I just was looking for some more details on the Hassan outbreak you mentioned. Do you know if that was related to one event or if there's any other information on that? And then why was Hassan classified as an outbreak, but the cases at UMaine were not?
So one quick note there. The cases at the UMaine, at least as it relates to the facilities team, have been opened as an outbreak investigation. Generally speaking, now there are so many outbreak investigations that are being opened. I just comment upon the ones where I want to make sure that people are aware of. That does not mean to suggest that if I don't mention it, it hasn't been opened as an outbreak investigation. That's not the case at all. With respect to Hassan, we are still in the early stages of our investigation based on very, very preliminary interviews that we've done. We are concerned. I don't want to say that we are concerned that this outbreak may be related to attendance at a party. I can't say that with definition yet, but that is a concern and a hypothesis that we are investigating more closely.
All right, thank you. And one very brief question. We heard from a viewer who is concerned about some people that she knows are planning to visit Maine for Thanksgiving from out of state. They told her that since they're only coming on a day trip and not spending the night, they would be exempt from needing a negative test. I assume that's not the case.
You are correct. They are wrong. It is the case.
Fair enough. Thank you.
Holidays, we've got to make sure that COVID-19 does not haunt our holidays. And that is a possibility right now. I'm going to turn now to Allison Ross at WMTW.
Hi, thanks so much for taking my question today. So back to that report on the Millinocket wedding, just one question. Will that report be useful to prevent or maybe even understand future outbreaks that we see here in our state?
Yes, it will, Allison. Not just in our state, but I hope also in other jurisdictions at local health departments and other state health departments as well. I think for epidemiologists, for disease detectives in other states, the report offers a couple of nuggets of information that are, I think, really, really useful. The first is characterizing in better detail how even brief interactions can generate transmission. And this is laid out in the description of how a single person who had attended the wedding had a brief encounter with somebody who was an employee of Maple Crest, who then introduced the outbreak there. But that encounter was not very long. Similarly, the report details how even at gatherings, COVID-19 can strike. COVID-19, of course, cares not a bit about whether we're celebrating something festive or something funereal. It affects everybody. And I think keeping that front of mind as other investigators are doing the work is important. The other thing that I think it will help other investigators keep front of mind is to look for connections between seemingly disparate events. We discovered the connection between the York County Jail and the wedding because we knew to look for it, because we knew to ask people at the jail if they had recently attended a new outbreak. So we found these things because we asked these things. And that, I think, is a really important tip or best practice that other health departments can utilize. I'm going to turn over to Charlie at the BDN.
Yep. Hi, Dr. Shah. Thanks. I guess this question could be for either you or Commissioner Lambrew, actually. Well, I guess this first one's really probably for you. It's whether, do you have a more updated assessment of how many of the new COVID infections you're seeing are related to indoor gatherings as opposed to outbreaks, and just any sort of specific, broad data you can share about that?
Sure. So Charlie, one of the things that we take a look at is, as cases come into us and are assigned out, one of the first questions our investigators ask is this new case potentially connected to any known open outbreak? And that sort of sets the investigation in one direction or another. And with increasing frequency or in recent weeks, on a daily basis, fewer and fewer as a percentage of the cases that are assigned for investigation are preliminarily apparent as being associated with an outbreak. The number varies from day to day, but in general, earlier in the pandemic, on any given day, 50, 60, even 70% of new daily cases were directly tied to an outbreak. Nowadays, it is on the order of maybe 20% of new daily cases being directly tied to an outbreak. So that gives us a sense of where cases are coming from. That doesn't mean it won't ever be tied to an outbreak. I just want to be really clear, Charlie. As investigations proceed, we may find connections, but in general, we're seeing a much lower percentage. The other thing that is asked at a more national level is whether folks have a sense of where they may have contracted COVID. And I don't have the latest data. I was briefed on it about a week or a week and a half ago. But similarly, nowadays, fewer and fewer people report even having a glimmer of an idea of where they contracted COVID from. I can't recall what the number was, but we can try to find it. So increasingly, we are seeing community transmission driving these. Now, the other thing is that people report having been as part of small gatherings. Now, whether they knew that that's where they picked up COVID for, they are increasingly reporting having gathered with friends in the week or so preceding when they got sick. So that's how we're starting to see a lot of the transmission.
Okay. And then related, following up from that, yesterday and to some extent today, you've addressed the need for people to wear masks and avoid these indoor gatherings. And I think yesterday you said you're still kind of looking at what other states are doing to tackle this new front, if you will, of people getting inside and catching it that way. I mean, can you be any more specific of whether the state is considering, for example, a ban on gatherings of more than 10 people, which apparently some other states have done, or anything like that, or anything more specific?
Yeah,
we don't have any specific announcements at this time. We are obviously looking at what different states have done in different contexts. There's lots of policy out there, from what you just mentioned on gathering limits to sector-specific policy to more on enforcement to more on public education. We are looking at every different option out there to assess, is it effective? Will it work in Maine? And what is our next best step? With, again, an eye to our principles, which is, as Governor Mills has said, public health is our North Star. We do recognize that getting people healthy is key to getting back to normal, to getting our economy going again. So we will continue to try to see what can we be doing to keeping the Maine public engaged, kids in schools, people able to go to work, people getting the services that they need, while recognizing that we may have to do more or different to protect the public health.
Sorry,
Charlie.
can I just ask one? I had a reader question as well. I just wanted to flip in, which is the reader was curious about the new restrictions on team swimming and what's the rationale for them, and would you consider moving swimming into a lower risk sports category?
Yeah, and we're going to, I think, clarify our community sports guidance today to say, if you're swimming and there's a virtual meet, that might be different than an in-person meet in terms of levels of activity. So we are trying to listen to the feedback that we've gotten and adjust as needed. We did adopt our levels for what is a low risk sport, a moderate risk sport, and a higher risk sport from previous guidance documents coming from the Aspen Institute from different states. And even though we've double checked and triple checked on team swimming, we still continue to have our experts say that it's a team. There are people engaged, they're close together. There's more risk for team-based swimming versus individual swimming. So that is remaining a moderate risk sport.
Thank you.
I'm going to turn things over to Lindsay Mills at News Center.
Good afternoon, Dr. Shah. Amy asked about this earlier, but I wanted to follow up about mask enforcement. We hear often from viewers that stores across the state aren't enforcing this mask mandate. We hear from business owners and police who say it's tough to enforce. So I understand police are part of the conversations, but what do those discussions with law enforcement look like? And if someone sees someone not complying, a business not complying, what should they do?
So I am going to begin by just clarifying what businesses do and don't have to enforce mask wearing by people in their stores. Is that we did target large retail with over 5,000 square feet, I believe, lodging and restaurant, just because they have people coming in and out, municipal buildings, state employee buildings, local buildings, as well as schools, because we do recognize that it's especially important to keep kids in schools to have face mask wearing. So those are certain targeted areas where we ask those people running those buildings to help us do the enforcement. But I will say it comes down to, nobody wants to arrest people for not wearing a face mask. We want them to understand why they need to do it, respect the need for other people around them to have you wear your own face covering, and then try to see how we can get people to come into voluntary compliance. So we just do continue to assume that, and most people in Maine have proven this, that they are interested in protecting themselves and other people. Make sure that we provide information and education when needed, providing warning, because we have had cases where there has been flagrant dismissal of these public health guidance, and we do act in an enforcement sense where needed, but it's selective, it's not universal for businesses in Maine.
And to round us out for the afternoon, I'm going to turn it over to Eric Russell.
Thank you both. I have a question about contact tracing, and Dr. Shah, you hit on this a little bit yesterday, but I'm hoping you can maybe put a finer point on it. Is there a ceiling for viable contact tracing? I mean, other states are effectively giving up, and I wonder at what point is Maine gonna, I don't want to say throw in the towel because I don't think that will happen, but at what point does it become just not feasible to do effective contact tracing? Do you have a ceiling, or is it really dependent on a lot of other factors?
So, Eric, there are two components to your question. The first is there a ceiling? Right? Is there a theoretical limit at which the virus becomes so endemic everywhere around us, everywhere in the community, that contact tracing loses its force? That's question number one. And then if yes, then what is that limit? And I'm going to again say what I think is the hardest thing for someone involved in a scientific enterprise to say, which is, I don't know. We have certainly not thrown in the towel with respect to case investigation and contact tracing. And that's because I don't know if there is a theoretical upper bound beyond which contact tracing loses its efficacy. I've heard some colleagues express that concern. I'm not sure if it's true. I think contact tracing continues to have value even when we are seeing increasing case counts. And so I think that informs my view of the second question, Eric, which is what would those numbers look like? What would that threshold be? Similarly, I continue to believe that contact tracing has value, but so we're not there yet. Certainly, however, as the number of new cases rises, we're continuing to turn up the dial to make sure we can meet those needs. It is a continuing challenge, though. There's no mistake about that. It continues to be a challenge. We're redeploying staff. We're training more staff to make sure we can keep up with it. But I don't think we're at a point in which it loses its force.
Okay, quick follow-up, if I could. Any suggestion from any of your contact tracing staff that people aren't being as forthright about their contacts as maybe they were before? Is there any suggestion that this might be happening where you're just not getting as good information from people about their contacts as maybe you would like?
I haven't heard that directly. Okay. Let me state that at the outset, Eric. I have not heard that directly. I have heard similar concerns expressed by counterparts of mine in other states. We haven't heard that, but I think your question raises something that's been on my mind a lot, which is stigmatizing certain behaviors. I want to caution people about behaviors that we believe are risky, gatherings, things of that nature, but I don't want that to turn into a stigma around those behaviors, because what I'm concerned about is what you hinted at, which is people not being forthright with contact tracers about places they may have been, gatherings they may have been to, parties they may have attended. If we start stigmatizing attendance at these things, then we may lose that vital information that allows us to reach out to other people who may have been at the party or who may have been at the gathering. So I want to warn folks about where we see the risk emanating from, but I don't want that to turn into a stigma such that people are reluctant or reticent to share it with us. We haven't seen that emerge in large measure in a pattern yet, but it is a concern that I've got.
Thank you.
Thanks for that question, Eric. I want to just wrap up by sort of starting where we're recapping where we started, which is just in the past 13 days across Maine, the situation with respect to COVID-19 has gotten significantly worse. We have experienced over 1,000 cases just in the last 2 weeks alone. Positivity rate has increased, and as the disease has spread to every single corner of the state, what we've seen is increasing hospitalizations and now increasing deaths. What we have feared for so long that may be coming as the weather changes and as folks change their socializing patterns is now squarely in front of us. We still have an opportunity to turn things around, and we still have an opportunity to make sure that those who are in the hospital and those who are grappling with this illness don't have to see others around them suffer. But as you're making choices about what you do when you leave your house or what you do when you invite people to your house, please keep in mind the number of people in Maine who have been affected. Keep in mind now the 160 plus families that have had to arrange for funerals for their loved ones. Keep in mind the hundreds of people who have been hospitalized with COVID-19. And keep in mind this one thing. I received an email yesterday from a well-known Maine person who reported that this person and their partner had both recently been diagnosed with COVID-19. And this person reported to me in an email that for them, the diagnosis of COVID-19 came as a shock, but more importantly, the medical effects, the feeling that it had on them, he said, or this person rather, not neither he nor she, this person reported that it was like being hit by a truck. It was, as this person reported, the worst thing that they and their partner had ever encountered. So as you're making decisions about what you do this weekend and who you interact with and what kind of face covering and what kind of distance you have, please keep in mind what this person has said. Keep in mind all the people who have been hospitalized, and keep in mind the families who have had to arrange funerals. COVID-19 is very real. It's very much in front of us. And the way we go from here and the path we follow from here is in the hands of all of us. So with that, thank you all for taking some time to tune in this afternoon. We look forward to speaking with everyone again on Monday. In the meantime, as always, please be kind and take care of one another. We'll catch up again next week.